educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is breast cancer, separating fact from fiction. We are live on Intellectual Radio. We just heard from the Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, I discussed say no to pink washing. Go over to YouTube, type in Intellectual Radio, and stay connected for any episodes you may have missed. The quote of the day is, "Your present circumstances don't determine where you can go. They merely determine where you start." Here are your trending topics for today. One of the two winning lottery tickets in the latest Mega Million jackpot of almost $500 million was sold in the area of Florida, battered by Hurricane Ian less than a month ago. The winning ticket was sold at a 7-Eleven in Fort Myers, Florida. The Florida Lottery said in a release, the residents in Fort Myers are still sorting through the damage in the area after Ian made a landfall on September the 28th. The other lottery ticket was sold at a 7-Eleven in San Jose, California. And the California Lottery said in a tweet that the winners will split the pot for $494 million. Those are your trending topics for today. If you are tuned in on any form of social media, like the show, share the show, invite someone else in on the show where they can get this valuable information. I'm so grateful for my sponsor on today. I have Pastor Michael Richardson with the Emanuel C.O.G.I.C, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel C.O.G.I.C at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel C.O.G.I.C-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we're from the Emanuel Church of God in Christ. We are building upon a solid foundation.
My special guest today is none other than our healthy solution expert with over 20 years experience as a family physician, and she is impacting lives every single day. Hello, Doc Michelle.
Hi, Lady ReShell. How are you today?
I'm good. So good to see you.
Good to see you. Start trying to stay warm. It's taking a turn for cold, but I hear good weather is coming by the end of the week. So.
You know what? I'm so excited that we're going to have some awesome weather this weekend because Warriors Talk will be having our 6th annual Survivors Night of Reflection Gala taking place on Saturday, you guys. I'm so excited. We're going to have so much fun. If you're able to stop by, Doc, please stop by. We would love to see you.
Absolutely.
Yes. So we're talking about breast cancer, the facts, separating the facts from the myths. And we know, Doctor, there are so many different information that goes on with breast cancer. And sometimes it shy people away from taking action and doing what they're supposed to do. So today we're going to dispel some of those myths and those facts. We're going to make sure that you walk away today feeling educated and empowered with the information. So one of my question that I had, Doc, was why do you feel that there's so much miscommunication when it comes to breast cancer?
Yeah, that's a good question, because sometimes we're hearing different things about what can cause breast cancer, who can get breast cancer, when I should get my mammogram, and all the different things that we are hearing in the media from different medical communities can lend to some confusion about what are my risks? When do I get a mammogram? What can I do once I'm diagnosed with breast cancer? And so we hope that during, this hour that we have together, that we can sort of shed some light on that and dispel the myths. But sometimes we get information from different sources, right? And we know now in the age of 24/7 news and everyone being an expert on things, there can be confusion related to breast cancer and what we need to do about it, prevent it, treat it, manage it.
I totally agree. Totally agree. Mylea is joining us today. Hey, Mylea, I know you're ready for this information.
Yeah,
Go ahead.
Good. No, I was going to say, as you know, breast cancer is very, very common. 1 in 8 women can be diagnosed with breast cancer every year. It is behind lung cancer in deaths in women. And really because we, over the years, we've learned a little bit more about detecting breast cancer early. They're doing lots of research on different treatment options from, clinical trials and all sorts of things that now allow women to not only get diagnosed earlier, but to live longer if they get the disease. But the key, if anyone takes anything away from our discussion today, it's really getting diagnosed early is what saves your life and gives you better quality of life.
Yes, I totally agree with that. If you are trying to join us on Facebook Live, head over to YouTube because we are having a little technical difficulties with Facebook Live for some reason. But you can always be kind and rewind. All right, so we're going to jump right in. Yes, I know, right? So we're going to jump right into the topic, breast cancer, separating facts from fiction. And the first one up is monthly breast exams, self-breast exams, that is, save lives. Because we're told to do them, right?
Right. Yes. And so for many years, right, we told women to make sure that you do your breast exams every month. But what we have found is that sometimes doing that breast exam every month can lead to detection of lumps that are not necessarily malignant and that can lead to unnecessary tests. And putting women through unneeded anxiety and things like that from doing your self-breast exams. However, I say that it's important to do them for sure, because many women can find their own lumps, right? But then you want to have a discussion with your provider about that, right? What's your age? Are you at risk? Is that lump tender? Is it non-tender? How long has it been there? So we'll do a full assessment of you based on what you come in with and your symptoms to determine whether you need a mammogram, do you need an ultrasound, do you need just what we call, active surveillance, just kind of monitor it, depending on who you are. If we find a lump in a 20-year-old, we have different suspicions, right, than if we find a lump in a 50 or 60-year-old. But it's important to do them, but we want you to, if you find something that's different, talk to your provider about it, and we can educate you about normal lumps in breasts. I tell women all the time, breasts are lumpy. And so finding a lump doesn't mean that it's cancer, and we don't want to put you through unnecessary testing, but let's educate you on what are your breasts like? Is this normal? Is it not? Where are you in your cycle? And all of those things.
Yes, I always say if you're touching yourself every single month, and you're right, you get to feel the different lumps and bumps, so you know what's normal. So when something is not normal, you can, take action and be proactive.
Right. That's right. Is this normal for you, or is it something that popped up out of nowhere?
And I think too, number 2 goes kind of along with what you're talking about as well. So people with breast cancer always find a lump. Is this fact or is this fiction?
Well, wouldn't that be easy if that were true, right? But that's not the case. Many people have no symptoms and are found incidentally on their screening mammogram, right? Because really small cancers, depending on where they're located in the breast, could be deep in the tissue. It may not be on the surface. There could be tiny calcifications that look abnormal. There could be other things, right, that we look at that you may not feel. So absolutely, that is fiction. People with breast cancer don't always find a lump at all.
I know I found my own lump, but I believe that mine started in the lymph nodes.
In the lymph nodes,
yeah. So when you're doing your breast exams, make sure that you're checking the lymph nodes as well, because it could be there. So
got to get under your armpits. We have lymph nodes, those glands, like when you get a sore throat, your glands get swollen, right? So same thing, anything wrong in the body, any inflammation, those glands will get swollen. And the gland, the lymph node that drains the breast, is under your armpits. And so that's why we talk about, feeling there, because if you feel an abnormal lump, right, bring it to your doctor's attention. Could it just be inflammation, or is it something else that could signify something more serious?
Awesome. So the third fact or fiction is mammograms can only help and not harm you.
So we think of mammograms as sort of the gold standard for detecting breast cancer. It's radiation, it's minimal radiation. We weigh benefit versus risk, right? We don't want to expose someone to having a mammogram if they don't really need that, right? And so we put all the pieces together. We put who is at risk. Do you need a mammogram? Would you benefit from an ultrasound? Would you benefit from this sounds normal and let's watch it, depending on your age and risk factors and things like that. And in the medical community, we say it helps because the amount of radiation that you're exposed to is minimal, but you don't want to put yourself to that if you don't have to.
Did you already talk about the false positives that come along with mammograms?
Yes, good point. Yes. So that's what we talk about. What's your risk? Are you high risk, right? Because if a 20-year-old feels a lump, but then gets a mammogram, right? But their risk, when we look at the whole picture, maybe they don't have a family history. Maybe they're in their 20s. Maybe they have lumpy breasts, and that's what this is, a fibroadenoma, some benign lumps, right? And then we put them through a mammogram. Something may look, like, oh boy, well, we've done this mammogram. Now we've got to go do a biopsy. And now we've got to do all these things to you when we may not have really needed to do that. And you get a lot of people getting mammograms that really don't need a mammogram, and you get what we call these false positives. Something looked like something on a mammogram, but really when we put the whole picture together for that woman, maybe she didn't need a mammogram, right? Maybe there were other options available to her. And breast cancer is very, we've got to make sure that we're catching things early, but we want to do those tests on the people who we feel are at risk for it. And as we know, we all know people who get breast cancer younger than what you think of as, okay, are you 50, are you 60, are you 70, right? We know people who are in their 30s that are getting breast cancer.
So I heard that the mammogram is not for people who are having issues with their breasts, right? It's a screening preventive measure, but the MRI mammogram is when you have a presence of a lump or something going on with your breast, and then you get the MRI mammogram. But the mammogram is not necessarily to, I don't want to say detect cancer, but
yeah, it's the screening mammogram, right? So there's a screening mammogram. It's your basic radiological screening of the breast, which if it is abnormal or looks suspicious for something, then we do a more specific test called an MRI mammogram or a diagnostic mammogram. There are different ones which give us a deeper look at the structures and the tissues, right? Not everyone needs an MRI. That's more radiation that you may not have to be exposed to, right? We don't give millions of women MRI mammograms if not needed. But the screening mammogram is where we start, right? It's kind of like for women, a Pap exam, right? We start with that, but if we see something, then we go and we look a little bit closer.
Yeah, you just mentioned the PEP exam. So I didn't know. I just found out that I did. So I did my annual, and the doctor did the PEP, and so she sent me my results, and she says, "Oh, you don't have to repeat the PEP until another 5 years." And I'm like, "What? Where did that? Like, when did they start that? Like, is it because of my age, or is it just because? Hey, Lisa, thanks for tuning in. Like, I
Hello.
never heard of that before. I thought you get the PEP smear every year." And she's like, "No."
Yeah. No, depending on, and that's been in place, oh my god, I would say at least 10, 15 years that's
Mhm.
been the case. But it depends on your risk factors. If you're in a stable monogamous relationship, have you had high risk behaviors? Have all your PAPs previously been normal? Right? We put the whole picture together. And if you are in that bucket, then you don't need a PAP every year. So you're absolutely
Yeah.
right. And that's the thing. We learn more in the medical field as we,
Yeah.
go through.
Yeah, I can say that she was very detailed, like very, very detailed. I
Good.
felt like we spent so much time together. We spent probably that visit was probably more than 30 minutes. I was in there. Like we just did everything. Cause my doctor before her, she moved out. She was pregnant and she moved to Canada with her husband. So this was like my first time seeing this doctor. So she just, she did everything. She sat, she talked, she did family history, like just
Good.
everything that you would want a doctor to do. And I was like, I'm so sorry. I feel like I'm taking up all your time. She was like, no, no, no. She was like, no, this needs to be done. Let's get everything done so that, I have all of my results. So she sent everything through the portal, and so I'm grateful that everything came back at normal levels. Everything is where where it should be. So, then moving
Good.
forward, I go in next year. We know where I was, and we know where I should be. So I was kind of just grateful that I was just telling her, do whatever you need to do. So I have these numbers. Especially being
Yes.
a breast cancer survivor, it's important to me just to know where I stand. Physically, so that I know how to continue to improve my health so I can have a nice quality of health moving forward.
Yeah. That's such a great point you bring up for a few reasons, right? So she took the time to not just do the procedure, but to explain it to you, to talk to you about family history, to talk to you about preventative measures. And that sometimes can be lacking in our community, or people are not going to the doctor to get these things discussed with them, right? So that was really an important. And if you're listening out there, advocate for yourself, right? It's beyond the procedure. It's okay, so what's next? What do we learn? Why do I not need this? Why do I need it? Right? Because people are going to follow through on testing and on their health measures if they understand why it's important.
Yes. And she even went over a little bit of nutrition with me because I was telling her, I'm a
Yeah.
vegan. I have a hard time getting protein. So she threw out some proteins that I can eat to get my protein, you know. We talked about weight, body mass index, and she was like, nope, you're right on the line where
Oh,
you should be. Your weight is within your weight class. If you want to gain a little bit, you can, but you don't need to. Like, you find where you are.
wonderful.
So, I was
Yes. Oh,
really,
she did a great job. You
she
have a great
did an
doctor.
excellent job. I
Good.
When I walked away, I
Good.
felt so empowered because I'm preaching to everybody, like take care of your health, be proactive. And then how can I say that if I don't go and do the same thing? So I felt good leaving there, know that, I've done what I was supposed to do. I can really talk and preach and say, go get your annual, do this and do that, because I've done it. So, and this was the first time, doc. This normally when I go in, I have the white coat syndrome, right? Every time I go
Mm,
in, heart rate just
mm,
beating out of my chest. For some reason, when I went to that appointment, my blood pressure was normal, my pulse was normal, everything was, I was like,
mm,
this is so weird. Like it was, I
mm.
don't know. So I think
Everything was in alignment.
it set the tone for a
Good.
really good appointment.
Good.
So yeah, I
Good.
was grateful.
Yes. Yeah, that's great because a lot of people don't have that experience when they go to the doctor, unfortunately. So,
You gotta go though. You gotta go.
mhm.
Lisa, I think did we get past that statement, Lisa? She says no, they stopped doing it for a while now. What was it? What
Yeah,
was it?
the PAPs every year. I
Oh,
think she
okay.
was
How come I
talking
didn't know?
about. Yeah,
Okay.
yeah. It's been a while. Yeah,
Okay.
depending on your risk, you could every 5 years.
I think I had one like 2 years ago, and but she never said anything. So she was like, if you want me to repeat it, I can repeat it, and then we could just go from there. I'm like, just repeat it, just so we'll know where we stand. So
Yeah,
yeah.
good.
Okay, see, I didn't even know
Good.
that, Lisa. I'm learning. I didn't even know. Okay, where we are, Doc? We on number 4? Okay.
Oh, okay, yes.
So we're talking about breast cancer, separating the facts from the fiction. And so this one says, if breast cancer is diagnosed when the tumor is small, it can be cured.
Yeah. So sometimes we hate to use the word cure, right? We say in remission, right? When it's been gone for some time, but we know that there's always a little bit of a risk of remission, right? So it doesn't matter if the tumor itself is small, right? Because we know that even with small tumors, they can spread to those little lymph nodes and, other things. But again, the sooner we catch it, we hope to catch it before it ever spreads outside of the breast, where you have a better chance that surgery can remove all of those tumor cells and hopefully they will not come back. But we talk about these, what we call micro metastases, whereas there's little tiny pieces of tumor cell that we may not know have spread, and then it can sort of linger and then rear its ugly head years later, right? So we hate to use the word cure, but we know that your chances of recurrence after treatment is best when your tumor is caught early and small.
Yeah, I think my doctor said no evidence of disease. So
no evidence
no
of
evidence.
disease. That's
Mhm.
right. No evidence, right?
Right.
And that's the best we can do, right? Because you just never know if you have these little micro things that
Right.
unfortunately escape
Yes.
your treatment.
I always said if you had cancer before, then you have that chance. Is always a chance, but you don't have to live in fear, thinking like it's coming up on you. Just be proactive with what you need to do for your health, your screenings, so that you can just live a stress-free life. But just keep in mind the fact that that it should keep you on your toes to do the necessary things.
Yes.
Yeah. All right. So number 5, fact or fiction? Breast cancer mortality rate is declining.
So this is an interesting topic, right? Because in general, we think that the mortality, how many people are dying from the disease, right, is declining, but it depends on your race, right? Because, for African American women, that's not necessarily the case because we tend to get diagnosed later where the disease is, further progressed and complications can arise and all of that. So, so the mortality rate for breast cancer for African American women is higher because of that, right? So, in general, for some populations, it might be declining, but for African American women, not so much. And we try to put this information out as best as we can, right? Because we want you to get your screenings done when we recommend them, 40 and above typically. And we want you to continue to follow up with those screenings, right? One screening is not enough because some people think they just get it once, they're good. And then do the other things that you can to decrease your risk. Like we know certain things that we can control and certain things we can't control, right? And that might be one of your facts of fiction, but obesity, alcohol use are important, and lack of exercise, right? So those things can increase your risk of breast cancer. Certain things you can't change, like your genetics, your age, your race, but the things that you can change, we should work to change those.
Yep, I totally agree. Though you have that power to do that, so take that control. Because we feel like with cancer, sometimes we feel like we have no control over, cancer. You just like it just happens and it'll just come up on you. But you have some things to help you decrease your risk. So use those things. Don't feel
Yes.
powerless. So number
Yes.
7, fact or
Right.
fiction. Everyone's breast cancer is the same. I mean, breast cancer is breast cancer.
Definitely fiction. It many types depends on where in the breast it develops, right? It depends on the type of cells. There are some breast cancers that are sensitive to estrogen, right? That have we talk about the estrogen receptor positivity and progesterone positivity can make those breast cancers we have more treatments for them. And so everyone's cancer is not the same, depending on the tumor markers, depending on where it develops, depending on the stage, where how far it has spread out of the breast. And there are many different treatment options available, from chemotherapy to radiation to anti-inflammatory medications, immunotherapy medications. So there's lots of things that, depending on what we see when our pathologists, those who look at the slides of your tissue, and they can tell us how that breast cancer will act, and then we get the right treatments for that breast cancer.
Oh, wow.
But they are not all the same.
Definitely. So don't compare your journey to someone else's journey. If they tell you what they've been through, don't compare it, because your experience can be totally different.
Right.
Different.
Yes, because we know that some breast cancers can act more aggressive than others,
Yes.
unfortunately,
So-
right? Triple negative breast cancers.
I was diagnosed with triple negative stage 2, grade B.
Mm-hmm.
Yeah. So, fact or fiction, we don't know how to prevent breast cancer.
So there's we talked about a lot of things out there that people hear about, right? That they think can prevent breast cancer. We know the things that can increase your risk of breast cancer, right? And we talk about, 50% of breast cancers are in women, over age 60, but we know women that can get it younger. We know that race, we know that age plays a factor, but the prevention piece is really, okay, so what things do you have in your control? And when we think about that, we think about, and we talk about this all the time on your show, right? Eating the right foods, exercising, limit your alcohol can decrease your risk of developing breast cancer, right? We don't have the vaccine to say, oh, you take this vaccine and we could prevent you from getting it like we do other diseases. It's not quite that simple with breast cancer, but we know that there are certain things you can do to decrease your risk of getting it. And part of it is exercise, a normal body mass index, make sure you're not obese, and limiting your alcohol intake.
Have you heard, Doc, about the vaccine I think they're working on for triple negative?
Yes, yeah. And I know there's some studies that are ongoing for that, and that would be wonderful, right? And I've heard of some patients that are in that study. So yes, because we know that the medications that we have, the chemotherapies, they don't really work very well sometimes for triple negative. But if we can develop a vaccine, and I tell you, I have so much respect for the oncology research space because it is quite a task and undertaking when we think about all the cancers. But luckily, there is relatively good funding for breast cancer research because of the incidence and the prevalence of it in the community. Yeah, but hopefully that will become, something that everyone can get at some point.
Yes. In May, I will be taking part in, it's called Lobby Day with the National Breast Cancer Coalition, where we go to Washington and we talk to the senators about, voting on issues with breast cancer funding. So I'm excited about that. Yeah.
Yes. And that is so important to continue to be an advocate and talk to the people who make the laws and divvy up the monies and all of that, right? So they can see a face that's impacted.
Yes.
Very good.
Yeah,
Awesome.
I'm excited about that.
Using your voice.
Yes. We're going to take a quick break. I just want to highlight our sponsor. We are live on Intellectual Radio. This is Warriors Talk with ReShell Matheny, and I have Doc Michelle, our expert that's breaking it down for us as it relates to these facts and these fictions with breast cancer. My sponsor right now is Paula Kelly with Allstate, who is also a breast cancer survivor. And she is located at 327 East Glenwood Lansing Road in Glenwood, Illinois. She could be reached at 708-758-3300. She is specializing in home, auto, and life insurance. Make sure you tell her that Warriors Talk sent you. If you're looking for an agency with integrity, she is your person. All right, you guys. So we are talking about breast cancer separating fact from fiction. And we're going to talk about family history, which I feel like this is such an important piece when it comes to breast cancer. Hold on, I see a comment. Lisa says, congratulations, and I know your voice will be heard. You are the perfect advocate, Lisa. I just love you, Lisa. I appreciate Lisa. She is just really supportive, just push me. She already know when I feel like I don't want to keep going. She prayed for me, like, oh my God. So I just love it. I love you, Lisa. Thank you.
Awesome.
And Lisa doing some big things too. Okay, so just off subject.
Okay.
So so she's doing this it's a documentary, and I hope I get the title right. My House, My Rules. I hope I got the topic right. So I got to play a reporter in the series of documentaries. So I can't wait for it to come out. I'm excited about some big things that Lisa is doing. So she, she's like, hey, I want you to be a part of it. I was like, me? So I was excited.
Keep us posted. I want to know when it's ready for viewing.
Yes, I was so excited. So excited. So I can't wait for it to come out, you guys. I know she's going to do like a screening. So when she does, I'm going to make sure that I put the information out there for you guys.
Please do.
So I'm excited. So family history, Doc. Fact or fiction? Most women with breast cancer have a family history of the disease.
Fiction, for sure. Fiction, right? About 85% of breast cancers occur in people with no family history. People think of that sort of genetic component, but that's really maybe 5% of people who really have a genetic predisposition. So it can happen in anyone. We know that if you have a certain gene, like the BRCA, BRCA1 gene, right, that increases your risk of breast cancer. But that is not in the majority of patients in females. And so we don't want to use family history as a reason to not get your mammogram, right? People say, oh, I don't have breast cancer in my family. I don't need that. That would be putting yourself at risk, because we know that anyone really, 1 in 8 women get breast cancer. So I would say if you're in a room with, over 10 people, 1 or 2 of them probably have breast cancer, had it. So if you think about it in that way, we want to be proactive and not use misinformation to not get our testing done.
Totally agree with that.
Mm-hmm.
As Donna Lynn would say, don't deny but verify. Go and verify the information for yourself.
Yes. Absolutely.
Yes.
Absolutely. Yeah, we have to. There's so much mis and disinformation out there that you got to get your information from the right resources.
That's true. Number 10, fact or fiction? Men don't get breast cancer.
Yes, they do. They do. Much rarer. I think 1% of breast cancer diagnoses are in men, but they certainly can get it. They tend to find their own lumps. But if men are listening, if they find a lump of some sort, right, they should get that evaluated at their provider office. Don't assume it's nothing, that you can't get breast cancer. I've had in my career, I think maybe 2 men who've been diagnosed with breast cancer that I've personally taken care of. So it can happen. It certainly can. And we want to dispel that myth for sure.
Absolutely. Lisa says, girl, yes, we are making moves. She said, I think what you're doing is so important. When I was diagnosed with ovarian cancer, I was dumbfounded.
Oh, yeah. I'm so sorry to hear that, Lisa, and hope you're doing well. But you are right that having Lady ReShell being a patient advocate and just a warrior is giving people so much information that they probably would not get anywhere else. And you're in that space where you're really, really needed and making an impact.
Yes. Number 11. The risk of breast cancer is often misunderstood. It increases with age. 50% of breast cancers occur among women aged 62 or older.
Yes. I mean, that's fact. That is fact because as you age, your risk increases more, like we said, over 50, over 60, over 70. But again, we know that there are women who get it in their 40s and 30s that I've diagnosed. And so it's important to know your what we call your relative risk, right? As you get older, your risk, if I'm 75, my chances are higher than if I'm 55, but in that whole age range, there is risk, right? So we recommend that women get their screening mammogram at age 40. But we know that, if you're concerned, if you feel something, if you're younger than 40, talk to your provider about it. And certainly you may need a mammogram younger than 40, but those screening mammograms, at least at age 40, that should be starting.
Yes, you have to stay on top of it. Like with my girls, I tell them 10 years before I was diagnosed, but if you're feeling something before that, don't be afraid to go in and see about it. Lisa is a 12-year survivor. Praise God.
Wonderful, wonderful. Yes. So glad to hear that.
Yes. We are on number 12. All right. Fact or fiction? In terms of survival, removing the entire breast is better than just removing cancer.
I would say that really depends on your specific disease. There are times where depending on the extent of the cancer, many cancer surgeons would recommend a lumpectomy versus a mastectomy, right? If you remove the entire breast and there's no more breast tissue, right, then you have completely removed your risk of recurrence in the breast. But you also want to, you don't want to go through that procedure if not absolutely needed. And that's why we talked about not every cancer is the same. You've got to have that discussion with your provider, right? Removing it depends, depending on where it is, how it's spread. You may need a full mastectomy, an entire breast being removed, or sometimes they can do a lumpectomy if those margins of the breast tissue is completely negative when they take a look at it. But again, that's a discussion you've got to have with your provider. What's best for you in your case? Because it goes back to one of the things we talked about before. Not every cancer is the same, so we can't really say.
Right. So yeah, it's a personal decision, and the I don't want to say the risk is the same, but the chances of it coming back, whether you get a lumpectomy or you get a mastectomy, is the same. So it's just it's a personal choice on what you want to do.
It's a personal choice. Yeah.
Mm-hmm. Number 13, fact or fiction? Does hair dyes increase the risk of cancer?
We have no definitive studies that show that hair dye increases the risk of cancer. I haven't seen any. And so, again, because we don't know the exact causes, right? I always say limit the things that you can, right? Decrease your exposure to toxins and chemicals as much as you can. Because we know it's not just family history, right? Anyone can get it. What are those risks? What are those things that we are putting into our bodies that may be causing that cancer gene switch to turn on, right? And we know that there's so many chemicals and toxins that we come in contact with. And our skin and our scalp is one of the largest organs. And whatever we put on our scalp and our skin gets absorbed into your bloodstream. So you have to look at all of that when we think about it.
All right. Number 14. You won't need surgery if the tumor is solid.
Fiction. Fiction again. The solid tumors are normally the ones that they want to remove, especially if it's cancers. If it actually shows breast cancer in that solid tumor, those are the ones that they want to remove surgically for sure. Again, every cancer is different. Even if it's a solid tumor and it has to be surgically removed, you still probably, depending on your cancer, need chemo, radiation, and other interventions. Again, I don't want to say, all or none, but solid tumors are removed surgically, and depending on the type of tumor and the spread, other treatment modalities are usually needed too.
So speaking of chemotherapy, and number 15 says chemotherapy always has side effects.
So that's a tough one, because the good thing now is chemotherapy, chemo agents, which are toxins that attack the cancer cells, but when they're attacking your cancer cells to kill them, it can attack your normal cells and cause side effects, right? Like nausea, vomiting, hair loss, neuropathy, tingling in your fingers and feet as well. So they tend to have side effects. The great thing is we have great other medications to help control those. Sometimes we give people a treatment break depending on the amount of side effects that they're having. Sometimes there are other options. That's one of the good things about cancer treatment, especially for breast cancer, that if you're not tolerating one medicine, sometimes you're able to switch to a different medicine. Some people do really well with chemotherapy. I've had patients who barely have any side effects. It depends on the agent, on the drug that is used, right? Because some of them can have significant side effects, but we use what we need to kill the cancer cells.
Yeah, my oncologist was like, "Yeah, we're not taking a break." I remember one day.
If you can tolerate it, you're gonna keep going, right?
Yeah, I had a fever one day, and she was just like, "No, we're gonna push through this treatment. We're gonna push through." No, so she was like, "Let's go. I don't want to break in treatment." So, and I think for me, I really feel like God shielded me when I was going through the chemo. Like I didn't get nauseated. The one thing I had really bad is I was really constipated, really bad with the chemo, but I wasn't nauseated. And of course, they give you the drugs before you take the chemo. So I didn't have any of that. Of course, I had like the normal hair loss, and I had the neuropathy afterwards. I have lymphedema now. So, but like, I feel like my side effects were like really minimal compared to like some of the horror stories that I've heard. I'm like, wow, did we both have the same type of treatment? We both took chemo? Because I really feel like I was shielded from a lot of it.
Yeah. And I really believe that how your body has been, right? If you had been taking care of yourself and staying hydrated and don't have a lot of inflammatory conditions and things, you do much better. And I think we talked about this before, that oncologists, hopefully, as they're talking to you about the medications, they're also talking to you about the non-traditional things, like making sure you stay hydrated and eating good nutrition and exercising if you can, so that all of those things work in your favor.
Yes, I was able to walk. So I would get up in the morning, like once I dropped the kids off, I would walk around this field by the house. And the doctor told me, you're exercising, keep exercising. It's going to help you. Just don't stop exercising. So I believe that really helped me. And then she sent me to a nutritionist, so that, since I was going through the chemo and, when you lose the taste in your mouth and you don't want to eat. So she's like, okay, go and see a nutritionist and see what it is that you can do so that you'll be able to eat, and get the nutrition that you need, even though you're going through chemo. Like, you still need
all of
nutrition.
that.
Yeah. And I did drink a lot of water. So the water helps flush out the chemotoxins. It helps to flush it out. So yeah.
Right. Good. Yeah. All of that is absolutely, I think, helped you, right? You didn't have a lot of side effects. You were able to get through the chemo without having to have breaks and things like that. And so that's a good point for, while you're going through it, as horrible as it's making you feel, it's important to have that sort of champion there to tell you, no, you need to eat these things for your nutritional support and exercising, because that's good, and getting the blood flowing through your body. As much as you want to not do it, it's important to do it because it does affect your ability to fight off some of these side effects and fight that cancer.
Yeah. All right. Number 16. Number 16 says cancer will always come back. I don't know if we covered this one already. We talked about you having
kind of, right? You always have a risk of recurrence, but we talked about, right, when you're treated, that if there's no evidence of disease or you're in remission, those some words, right? That means that right now we don't see any evidence of disease, but we always have to be vigilant, right? You're always going to be doing your surveillance and you're following up with your medications that you're prescribed afterwards, and making sure you're still getting your mammograms. So it doesn't always come back. We know many women who don't have a recurrence. And again, that is sort of based on making sure you're getting the right treatment, making sure you're diagnosed early before it has spread out of the breast is going to give you your best chance of survival and, no recurrence.
Awesome. Number 17, oncologists don't want patients trying unusual treatments.
Yeah. Well, oncologists are doctors, and so they want patients to try what we have studied, what we know has worked, that has gone through clinical trials. I have had patients who wanted to try alternative things, and I say, if it's okay with your oncologist, you could do it along with your chemo treatments, but not instead of your chemo treatments, right? And I think oncologists are becoming a little bit more open to that because people are sort of getting more knowledge around holistic things. And I think if someone feels that something could work, sometimes it will work, right? But it's important to have a good conversation with your treatment team and not do the things that we know work as best as we can, along with the other things, depending on what it is that you want to try.
Yeah, I know. I was doing the black seed oil when I started chemo. So she did ask, like, are you taking anything else? And I told her I was doing the black seed oil. So she went and printed up some information on the black seed oil. She read up on it. She says, okay, I just don't want you to do it while you're doing chemo. Like, when you're done with chemo, you can start it up again. But while you're doing the chemo, just don't take it, because I'm not sure what type of effect it's going to have while you're doing the chemo. So, you can take it after you're done.
And that's a good point. Yes, that's a good point, because we don't know if, when we did the study on these medications that help your cancer, it wasn't done in the presence of black seed oil. So we don't know if you taking that along with your chemo could have any effect on how effective the chemo is going to be, right? We want to keep things sort of in line with how the drug was studied, the dose, what were the patients on. And so we want to eliminate the chance that anything else could be interacting with it, right? So always have that conversation, because even as a family physician, right, I know that patients are taking a lot of supplements as a side topic, but maybe it's interacting with the prescription medications. And so it's important to have that conversation with not only your oncologist, but your primary care provider too, if you're out there taking a lot of things that could interact with your prescription medication. Sometimes maybe it's making your prescription medication not work as well. Maybe there's an interaction, and we've got lots of books now that tell doctors about those interactions, because we didn't learn it in school. If you're seeing an older doctor, we weren't learning that 20, 30 years ago, but it's important to let them know what you're taking so that we can at least look in a trusted resource to see if there's an interaction.
Yes, because I wanted to take some supplements while I was doing the chemo, and the doctor was like, go and see the nutritionist first before you start taking anything. And so the nutritionist told me you could get your supplements from your food. You just have to eat the right food. I wasn't deficient in anything, so it was just because of the chemo, So I didn't take any supplements. I just was whatever I could eat. She was like, eat that until you get the appetite back. Just if you got to eat the one thing until you get the appetite back, then do that.
Yes.
Then do
Good,
that.
Good.
So as we wrap up, Doc Michelle, can you give us some words of wisdom as it relates to just separating the facts from the fiction as it relates to breast cancer, so people can be, aware when they're making decisions?
Yeah. Thank you. I think one of the things we need to focus on is making sure that if you have questions or concerns or hesitations about getting a mammogram, about should you be doing your breast exam, about a lump that you may feel, is to have a conversation with your provider, right? Because they cannot help you if you don't bring that up. And hopefully that provider will give you the information to allow you to make an informed decision on what you want to do. So the first thing is, don't let fear, anxiety, uncertainty stop you from managing your health and getting your mammogram, because that's the only tool we have right now to diagnose breast cancer is your mammogram. And then, just separating the myths from what's actually true, right? Make sure you're getting your information from a trusted source, because everyone can be an expert. There's a lot of things on the internet that we can find, but get your information from a trusted source as well. And really just, ask questions of your provider if you have questions that you want addressed. If you remember that family history really is a minimal part of your risk. 85% of patients who develop breast cancer have no family history. And then change the things you can, which are the risk factors: obesity, lack of exercise, and alcohol intake are things that we know can increase your risk. And so you want to be mindful of that as well.
Awesome. Thank you so much, Doc. I appreciate you coming on, dropping gems. I know that everybody feel educated. So make sure you share this information out. You guys join me next Monday at 6 p.m. right here on Intellectual Radio. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on IntellectualRadio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.